Welcome back. You're watching Morning Express, and it's time to talk about your health. And joining me for that discussion on emergency medicine is Dr. Benjamin Wachira, who's the assistant professor of emergency medicine at the Aga Khan. Welcome to the show, Mr. Wachira.
Thank you very much.
Okay. Now, Dr. tell us, what on earth is emergency medicine?
Well, simply put, emergency care or the emergency medicine is the care you get from the moment where you have an acute illness or injury to the point where I'd say you get admitted into the hospital. So, for example, you've been in a road traffic accident, or you have your baby choking at home, or you have a fall somewhere out in the streets. So the care you get from the point where you fall acutely ill or injured, needs to be provided within a very short period of time to save your life or your limb, then that would be classified as emergency care. So it's that acute care when we all feel like we're having an emergency, and if nothing is done, someone's going to die or someone's going to lose a limb or life. Yes, limb or life.
Now, as a layman, what comes to mind perhaps is ambulances, paramedics, first aid. Am I correct in thinking like this?
Yes. So that is what we call pre-hospital emergency care. And the pre-hospital services then bring you to the emergency department of the hospital, where the emergency care that they have started pre-hospitally then continues into the emergency department.
Okay. Now let's take a look at the current situation with the coronavirus, and perhaps that making it difficult, or rather making people afraid of getting medical health help. Does this affect or does this increase the need for emergency medicine right now, in your view?
I think yes, and I think one of the things that coronavirus has brought out in our country and even across the continent is the dire need for emergency and critical care services. So right now, the biggest emergency we are having with the corona patients is patients who are getting short of breath or needing oxygen, and then they then have to be brought into the hospital to receive that oxygen or receive that respiratory support, where we need to put them on a machine. So what we are having right now as a crisis in the country is we do not have enough machines to put all the patients who are suffering from severe respiratory disease from the coronavirus. We do not have enough machines to put them on. We don't have enough machines to support all the patients, and that's why we're also having a challenge. So, and also the other part of it is many people, again, remember, most people in Kenya use private means, whether it's a taxi or matatu to get to the hospital. Now, with the pandemic, and especially when with the curfew hours, then you cannot really, no one wants to carry someone who's having shortness of breath in their car, and no one wants to carry someone and the ambulances and vehicles are not operating after hours. So this is where now there's actually more need for emergency care, where if you're having any shortness of breath at home, then you call an emergency number and an ambulance comes and picks you up. So because of that, we have a lot of patients who are showing up really late to the hospital, having suffered for hours to days at home before showing up. And this is actually a big challenge, yes.
Right. Up until recently, I had no idea there was a an emergency medicine Kenya Foundation. Tell us more about that and why it's important to our communities.
So the Emergency Medicine Kenya Foundation was actually formed 5 years ago, and this was formed by healthcare professionals and different stakeholders and partners with the idea of strengthening emergency care in Kenya to ensure every Kenyan has access to high-quality, timely emergency care, life-saving emergency care. One of the biggest gaps we've had in our healthcare system over the years is no really well-established emergency care system. If you look at the West, you have your 911 or 112 ambulance service, and this then, and for those who like watching TV, there's ER on TV, there's all these shows about the emergency department. So we have had this as a significant gap in the country, and many people actually have lost their lives due to lack of emergency care. And even some prominent politicians have lost their lives due to lack of emergency care. So the foundation was established purely to safeguard every life, every time, everywhere across the country, and work with the Ministry of Health and the national government to strengthen the emergency care services in the country.
Absolutely. Now, when you talk about that, sometimes you hear horror stories of people not being able to be given particularly at hospitals, sufficient emergency medical care because perhaps they weren't able to deposit a certain amount of money or prove that they can pay for the treatment. How does the foundation step in to ensure that even with our limited capabilities in terms of finances, people can be afforded that sort of treatment and not lose their lives just because they didn't have a certain amount of money?
So the first part of it is looking at and reinforcing what the government has already put in place
Yes.
through the Constitution of Kenya 2010 and the Health Act 2017, which essentially guarantees every Kenyan the right to emergency medical treatment. And any facility or healthcare provider who denies someone emergency medical treatment is liable for prosecution and for facilities even a fine up to 3 million Kenyan shillings.
Right.
But more importantly, and that's one of the things that we are working very hard with the facilities for people to understand, is emergency treatment and getting admitted are two separate processes. So the idea behind emergency care is to, when you get to the facility or when you show up at the facility, then the initial care to save your life. And I think this is also something else that also the public needs to understand. Complete treatment to recovery is not necessarily emergency care.
Okay.
Emergency care is that care that if it's not provided within the next, I'd say, hour, 2 hours, then
Right.
you have a high probability of dying or losing a limb or suffering a protracted hospital stay for no good reason. So there are defined definitions in terms of emergency care. And this is, for us as a foundation, we're working very closely with the facilities and also trying to explain to the public that not everything is an emergency,
Yeah.
but for the emergencies, you are entitled to get that care. And the facility is supposed to provide you with the care to save your life. And no one should be denied care, life-saving emergency care. You may be denied. I mean, sometimes, for example, I'll give you an example where a patient comes and they have this medical condition. So it's not life-threatening,
Yeah.
and they're completely stable. So private facilities at this point would be like, okay, so based on our assessment, you are not having an emergency, but you are sick.
Yes.
So we're not saying you're not sick, you're sick, but it's not an emergency. So in this case, of course, then if it's a private facility, then they would demand that payment be made first before they provide care. But for emergency care, where your life is at threat, then
Yes.
every facility is supposed to provide you with this care, regardless of your ability to pay.
You have a right to it. Now we're going to take a short break. When we come back, we shall talk more about emergency medicine. Stay tuned to Morning Express.